Are you wasting money on your calcium supplements? Hi, I'm Dr. Crockett, and this is Dr. Crocker with Zeal Integrated Health. And today we're going to talk about calcium.
Yep.
You know, a lot of people, they have this belief that they need to take calcium to really protect them from osteoporosis and some of the other, just benefits that calcium can supply, but oftentimes they're just not absorbing it, or maybe they're getting too much of it. So if you don't have proper pH and proper acidity, you're just not going to absorb these things. So let's talk a little bit about how we absorb calcium and start with that.
Yeah, so one of the things is that as hydrochloric acid decreases with age, osteoporosis is actually one of the things that's going to come up. You're going to have lack of minerals in your system, and therefore, when a lot of times what's happening nowadays is we take antacids. Well, antacids is actually going to decrease the amount of hydrochloric acid in your system. Therefore, you're going to decrease the amount of availability that you're getting from your calcium. And so when you do that, if your calcium can't absorb, there's going to be things that you're going to have problems with, like poor hair and nail growth. It's going to be a mineral deficiency, and you're just really not going to get the most out of it. So, then what happens is we take more and more calcium, and then that leads into bigger problems.
You bet. Yeah. So you think of somebody like heartburn, they think they're fixing the heartburn with an antacid, and then ultimately this is depleting their ability to absorb calcium, and now we've got deficiencies. But somebody that's taking calcium all the time can also end up with excess calcium in their system. And when that happens, you start seeing things like kidney stones develop, bone spurs. You start seeing calcifications of the arteries, causing heart disease and increasing risk of just cardiovascular issues. So too much calcium in the system can create issues as well. So a lot of people think, well, it's over the counter, I can take this, and they don't have to worry about it, just follow the instructions on the bottle. But you really need to look at your physiology in these situations to know what's right for you. Are you somebody that should be taking calcium? Or are you just wasting money on it, maybe putting yourself at risk for other issues? Yeah,
and that's one of the things is you say, well, how can I even see some of these things just on the outward appearance? Well, what you're going to look for is that if you have calcium deposits on the knuckles, some of the white specks that you see in your fingernails, those can be related with mineral deficiency, zinc deficiency, but also calcium absorption. Other things is that if you're a female and you're going to get a mammogram and you see that you have calcium deposits on that mammogram, you're not absorbing your calcium correctly whatsoever. And there's things that you can do to get around some of those things, but some of the causes behind this are going to be things that you're doing all the time. Drinking carbonated beverages. If you have a poor diet that's really low in minerals, or you're just overusing a lot of your antacids, these are going to be things that can lead you into problems that we were talking about now. So there are a few things that you can do to change that.
Yeah, those are really going to create some of those deficiencies that we were talking about. And then supplementation, when we look at supplementation of calcium, there's a couple things that we want to look at that can benefit the absorption of calcium. So your hydrochloric acid supplementation might be something that you need just to get that calcium into your system if you're dealing with a low calcium level. Vitamin D3 and K2 can have K2 can help drive calcium from the blood into the tissue so that it doesn't calcify those arteries and increase heart disease. So there's some cofactors, we'll call them that can benefit the calcium utilization. So, the first thing I'd say to figure this out is get a blood test done. It's a very simple, just metabolic panel can give you your calcium levels in your blood and really give you some insight into whether you should be even using calcium supplementation to begin with. So if you'd like to learn more about this, check out some of our other videos and share this with other people and subscribe below.